Let's talk about the recipe for injury. Early in my career, I was seeing patients come in and out the door and started to think, well, there's got to be some similarity with these patients. What's happening for these patients to break down? So I started looking at it and kind of dissecting things and looking for similarities throughout the scope of the diagnoses that I was seeing. What I figured out was there were certain things that when those things came together at a certain amount of time, that created not only acute injury, but also led to chronic breakdown and chronic injury. So I thought, well, if I can prevent these ingredients coming together, I can prevent these people from getting injured. If I can reverse what happened when these ingredients got together and reverse that progression of injury, I can help these patients who are already injured get back on the field, get back to work, get back to their normal activities of daily living without pain and injury. So what I figured out was there's 4 ingredients to the recipe for injury. And those ingredients are gravity, end range of motion, transverse plane movement, or a transverse plane component, and neuromuscular inhibition. Now as we break this recipe down, the first 3 ingredients, gravity, end range of motion, and transverse plane component, we are not going to be able to eliminate. Gravity is always there. Gravity is always going to be causing compression at the joints. We better figure out how to be successful when it comes to gravity. End range of motion. Everybody's got to get in and out of the end range of motion, especially if we're dealing with an athletic population. Great athletes are great because they are able to get in and out of that end range of motion quickly and safely. We can't eliminate those patients from getting in that position. Transverse plane component. All functional movement has some type of transverse plane or twisting component to it. Whether it's a hamstring pull, ACL tear, ankle sprain, herniated disc, all of those things have transverse plane components. The people that aren't successful in the transverse plane will become injured. Once again, we cannot eliminate the transverse plane, especially with athletes, especially with active people. We need to let them live in the transverse plane, but make sure they're successful in the transverse plane, just as they are with the end range of motion. So the only ingredient that we can actually control and eliminate from that recipe is neuromuscular inhibition. What is neuromuscular inhibition? In order for a nerve to fire correctly, it has to be stimulated by nerves. If that nerve doesn't stimulate that muscle at the appropriate time, with the appropriate amount of facilitation, that muscle will not either contract on time or it won't contract with enough force to help that joint stay strong and stable. Therefore, when that athlete or that person gets in the end range of motion and they have a transverse plane component and they have gravity applying pressure, they can't be successful. That muscle's got to fire at a certain amount of time, on a certain time, with a certain amount of force to keep them safe, to get from going this way to going that way. So how can we live with those first 3 ingredients in the recipe and get rid of that 4th ingredient? One thing that you'll be surprised with is a lot of things that we do as physical therapists, a lot of things that we do as strength and conditioning experts, as coaches, actually cause neuromuscular inhibition. What are those things that we're doing to cause the inhibition to allow that recipe for injury to occur? How can we make that neuromuscular junction as sensitive as we possibly can? Great athletes are great athletes, and people that avoid injury, and the people that come back quickly from injury, because they are extremely sensitive at that neuromuscular junction. So how can we make sure they maintain that sensitivity? And the people that don't have that sensitivity, how can we make them more sensitive? How can we give them normal neuromuscular facilitation so they don't have to see people like me, so they don't have to be in the training room,